RN is a patient of ours in therapy. She's completed the first 12 weeks of therapy. Can you put into your own words, what kind of difficulties did you have? What kind of problems did you have? Can you explain what you went through before therapy and the changes that you're now noticing?
Well, the challenge was I was getting fatigued early in the afternoon, and I was having difficulty reading any length of time, and I would feel eye strain when I would drive. After driving maybe 6 or 7 miles now, I'm going 40 miles back and forth, and it seems to be less of a strain for me, and I seem to hold up a lot better.
Good. Can you tell us a little bit about what brought this on?
I believe it was from having LASIK. I never had a problem with my eyes working in conjunction with one another before I had LASIK surgery. And I should have just stuck with the cataract surgery, which was necessary.
And tell us a little bit about what the surgeon did for you with that LASIK surgery.
Well, it was mono, and he thought I'd be a good candidate for it because apparently my eyesight was similar.
And simply to explain what mono means, or monovision, is whereby one eye is set for distance and the surgeon sets the other eye for near, like for reading. So a person can, in theory, be able to see down the road as well as read. But in some individuals, that big difference between the two eyes makes it disconcerting and unbalanced. So one of the first things that we've done here is we've given you eyeglasses to make it so that it's more balanced. And the second part that we've done in therapy is taught you the ability to regain the use of the two eyes together as a team. And now, what kind of improvements have you noticed?
Well, I might also mention that having LASIK surgery created a great deal of dry eye to the point where it felt like I had salt in my eyes. So I had to take medical drops to try to counteract that. I think the therapy, focusing and trying to focus and doing the different exercises helped as far as having my eyes converge together, or they work together, which is what they weren't doing before. And it did create balance issues also.
Good. Because you said that
Reading.
What you described just before is that now you're reading faster, you feel better coordinated, you have less fatigue, and you're able to hold up a bit better, less strain when you're driving, able to do near work for longer periods, fewer headaches. You feel that you can walk better without feeling that off-center feeling that you felt before, and that you don't get fatigued when driving as much.
Correct.
These are awesome changes, and considering that we've gotten these improvements even at this point before you go down to Florida, we've gotten these changes and improvements within the first couple of weeks. That's awesome. And as we said before, once you return back from Florida, we'll be able to render the remainder of the therapy program, so that this will no longer impede you or make things difficult for you. Great. Anything else that you'd like to add?
No, I'm just I'm happy that I did do the therapy because I have something to work with, and hopefully if I keep doing the exercises, I can only get better.
Wonderful.